Welcome to the all viewers and well-wishers of the world. The purpose of my lecture is learn the knowledge from the world, return the knowledge to the world. Motto of my life is learn, earn and return. I have learned a lot, earned a lot, now to return a lot to the world. The topic of today is tetanus, a very important topic, mostly seen after having any injury. So, introduction of the tetanus. Tetanus is also called lockjaw, is a bacterial infection caused by the Clostridium tetani, a neuromuscular disease in both man and animals. Disease affects nervous system of the host. It is characterized by the muscle spasms. Mostly spasms begin in the jaw and progress to the rest of the body, so it is called lockjaw. Each spasm lasts a few minutes. Spasm occurs for 3 to 4 weeks. Some spasms are severe enough to fracture the bones. And here it is the typical opisthotonus in a patient suffering from tetanus. That was the painting by Sir Charles Bell in 1809, and that is the posture which is seen in classical tetanus. And the disease is caused by Clostridium tetani, and that is just the bacteria Clostridium tetani without spores. These are the gram-positive bacilli, and these are rod-shaped body as one can see. And now it is going to change. The vegetative cell is going to change to have the spores. So with spores, it is rod-shaped body with spores, which are the terminal spores, and here the everything that is rod-shaped body is detached, and the spore remains, which is having a core and the coat and the cortex and the germ core wall. And this spore, but the conditions are not good. These bacteria do change to the spores, and when the conditions are good enough, these bacteria change to the vegetative cells and divide and just release the toxin causing this tetanus. Now, other symptoms of the tetanus are fever, sweating, headache, trouble swallowing, difficulty in swallowing, high blood pressure, and a fast heart rate, which is called tachycardia. Onset of the symptoms is 3 to 21 days following infection. Recovery may take months. About 10% of cases are fatal due to the paralysis of the respiratory muscle, which cannot be reversed sometime and causing the death of the patient. Clostridium tetani is found in soil, saliva, dust, and manure. The bacteria enter through a break in the skin like a cut or punctured wound by a contaminated object which carries these bacteria and its endospores. Now, history of the disease is tetanus well known to the ancient civilization. There was a relationship between wounds and the fatal muscle spasm. An early description of the disease was made by Hippocrates in 5th century BC. The cause of the disease was determined in 1884 by Antonio Carl and Giorgio Raton at University of Turin. They both were able to determine that the cause of the disease was Clostridium tetani. In 1884, Arthur Nicolaier isolated strychnine-like toxin of the tetanus, which is the very toxic toxin, neurotoxin from free-living anaerobic soil bacteria. Tetanus toxide vaccine was developed by P. Descombe in 1924. Now, incubation period usually 10 days, but maybe up to several months. In general, for farther the injury site from the central nervous system means away from the central nervous system, longer incubation period, shorter the incubation period, more severe the symptom. It means the injury is very near to the central nervous system. In trismus nascentium, trismus nascentium, that is also called neonatal tetanus, symptoms usually appear from 4 to 14 days after the birth and average is about 7 days, that is after birth, the tetanus develop in the neonates. Now, what are the reservoir of these Clostridium bacteria and endospores? Number one is the soil. Every environment throughout the world contains this bacteria and its endospore, especially in manure-treated soil. Number two, the reservoir is intestine or the feces of the animals like horses, sheep, cattle, dogs, cats, rats, guinea pigs, and chickens. A human and these hosts excrete spore in their feces. Spores withstand extreme climatic conditions and remain dormant, that is, inactive for years in soil and dust. Tetanus occurs when spores enter host through a deep wound which promotes anaerobic atmosphere. An endospore now begin to metabolize and cause infection in an adequate environment and changes to the vegetative cell which is capable of dividing and releasing the toxin. Now, resistance and susceptibility. Spores are highly resistant to the adverse condition but varies with the strain. These are mostly killed by boiling for 10 to 15 minutes, but some strain can withstand boiling for 3 hours or dry heat 160 C centigrade for 1 hour, but all will destroy at 121 degrees centigrade per 15 minutes at autoclaving in moist heat. So autoclave is the only way to kill all these bacteria as well as the endospore of these bacteria. So things are just sterile with the autoclaving. Spores survive in soil for years and are resistant to the most antiseptics. These are killed by exposure to the iodine 1% aqueous solution, hydrogen peroxide 10 volumes, and glutaraldehyde 2% in few hours. Now, epidemiology of the disease, Clostridium tetanus is found worldwide. Generalized outbreaks have had a high incidence of tetanus. It has declined with widespread use of the immunization. Before that, it was very fatal and seen most of the time. Tetanus is rare in most developed countries now because of the vaccination and proper autoclaving of the things. Mostly seen in elderly with declining immune status, failure to receive timely tetanus booster vaccination, more common in the developing countries where climate is warm and in rural area where soil is fertile and highly cultivated, containing lot of spores and bacteria. Now, continuing the epidemiology, where human and animal population is sufficient and live in close association, so poor hygienic condition, where unhygienic practices are common and medical facilities are poor. In underdeveloped countries, tetanus is still leading cause of the death. Mortality rates remains 85% for the neonatal tetanus and 50% for the non-neonatal tetanus in the underdeveloped countries, and also seen in uterine tetanus and autogenic tetanus when the female go for the abortion with unsterile instruments. Now, causes or the risk factors. Tetanus bacterium, Clostridium tetani as Clostridium endospore are ubiquitous. In people not well immunized, more common in hot, damp climate with soil rich in organic matter or manure. In agricultural areas, agriculture workers or the gardeners more prone because spores are present in the soil and they can get accidentally the entry of these spores into the skin. Spores are found on the skin surface and in contaminated heroin in heroin users and particularly who inject drug subcutaneously. So here one can see the Clostridium tetani with the terminal spores, and here again the terminal spore and the rod-shaped bacteria which are forming the spore, which are resistant to the harsh condition of the weather and environment. Now, the drug user, heroin user, these are just injecting the drug intravenously and that can just get entry of the spores through contaminated needle and unsterile syringes. Similarly, the gardeners and the agriculture workers, they are exposed to have any cut or injury during their work. They can have the chances of tetanus more as compared to the non-gardener and the agriculturist. Now, rarely through surgical procedure, intramuscular injections, compound fracture, and dental infection are also responsible for spread of tetanus. Animal bites can also transmit the tetanus. Tetanus is also associated with the rust, especially rusty nails. Rust itself does not cause tetanus. Objects with the rust are found outdoor that harbor the anaerobic bacteria Clostridium tetani with its spores, and the rough surface of the rusty metal provides crevices for dirt containing Clostridium tetani. Here one can see the tetanus bacteria that can be having just the injury to the foot, and the tetanus bacteria can enter. Similarly, the nail which just have the prick at the foot are also responsible. Similarly, the lacerated and the open wound and the person who have got the injury because of the barbed wire. The main thing is that open skin for the invitation of the Clostridium bacteria and its endospore leading to the tetanus. Now, cause and risk factors continuing. The nail puncture the skin and deliver endospores deep within the body. So stepping on a nail, rusty or not rusty, may result in a tetanus infection as low oxygen or anaerobic condition and the environment is available under the skin for these bacteria to grow well. A common misconception is that rust is the cause. Actually, puncture from an even rust-free nail is a risk that just put the bacteria and the endospore deep into the wound which is having the anaerobic condition. The disease does not spread between the people. Hitler, the great conqueror, he once said truly that when you are in light, everything will follow you. But the moment you enter the dark, even your own shadow will not follow you. Means when you have everything, your relative, your friends, and your just people around you are with you. But when you are in bad time, even your own shadow will leave you and will not follow you. So be careful. Now, tetanus toxins. These are of three types. Number one is tetanospasmin, which is very potent and very lethal toxin, very powerful plasmid encoded heat labile oxygen stable neurotoxin, most poisonous substance known, and it composed of the single polypeptide chain. Molecular weight is 150,000. All symptoms in the tetanus or toxemia are due to this extremely toxic toxin and intracellular toxin released by the cellular autolysis, not destroyed in blood, good antigenic, so easily and specifically neutralized by the antitoxin because it is antigenic. The body is able to make antibodies against it and to just get it neutralized. Prevent the synthesis of the acetylcholine, so the muscle spasm, hyperreflexia, and the spastic paralysis. Here one can see the mechanism of action of the tetanus toxin, that is neurotoxin. Here one can see the Clostridium tetani that is going to produce exotoxin that is called tetanospasmin. And here the nerve fibers, one can see the excitatory transmitter which are here, and these are going to be released and these are going to be taken up by this part of the synapses, so that is going to have the excitation. Now these tetanospasmin just come here and these just do not allow the inhibitory transmitter to come here and to work. So after the excitation, there is inhibitory. When the muscle contract, there is the relaxation of the muscle by the inhibitory transmitter that stops the excitatory transmitter. But here one can see the inhibitory transmitter release is blocked by this tetanospasmin, which is just there, and so the result is continuous stimulation by the excitatory transmitter which is here. So this is working and this is not allowed to work. So the result will be excitation and there will be continuous stimulation by these transmitters. Now, containing the tetanus toxin. Number 2 is tetanolysin. It is heat and oxygen labile hemolysin, as the name is, that is capable of destroying the blood cells, act as a leukocidin, so killing the WBCs and lyse RBCs. That is just as the function is, they are capable of hemolyzing leukocytes and RBCs. Antigenically related to the oxygen labile hemolysins produced by the Clostridium perfringens, Clostridium novii, Streptococcus pyogenes. So these are related to the hemolysin which have been produced by these bacteria. It is not relevant in pathogenesis of the tetanus. So the third tetanus toxin is non-spasmogenic, peripherally active neurotoxin. Role in the pathogen is not yet clear. So now coming to the pathogenesis, how the disease occurs. Infection initiates with the contamination of a wound with Clostridium tetani. Spores enter through accidental puncture, wounds, burns, umbilical stumps, frostbite, and the crushed body parts that gives entry to the Clostridium tetani with its spores. Tissue damage provides an environment suitable which is for these bacteria, and that is anaerobic environment because these are the bacteria for anaerobic growth. So that environment is being provided by the tissue damage. Now, spores germinate in anaerobic environment in devitalized tissue for vegetative cells to grow, replicate, and release the toxin. Organism itself is not invasive and remains confined to the necrotic tissue, but it releases diffusible lethal toxin, exotoxin, that ascends along nerves and reaches central nervous system. Now, the events in the tetanus, as one can see, the bacteria enter through this nail to the foot. From the foot, it is just going to travel along with the nerves and axons and reaches to the spinal cord. And here one can see the spinal cord as one do see that it is toxin molecules here, and spinal inhibitory neuron is here, and here it is the inhibitory is just prohibited and the excitatory is there, so there will be resultant extension and the flexion of the muscle, and these cannot be inhibited because of the blockage here by these uh, tetanus toxin, and result will be the muscle spasm, the extension and the flexion of the muscle, and also the lockjaw. So the inhibition of the spinal inhibitory neuron will lead to that excitatory mechanism more pronounced. Now, pathogen is continued. Trans- the toxin is transported by retrograde neuronal flow or by the blood. Toxin spread upward intra-axonally along spinal cord. It interferes with the normal conduction of the nerve impulses, thus leading to the tetanus. I have told you the inhibitory pathway is stopped and the excitatory is overactive, leading to that tetanus. Toxin start travel primarily through neuromuscular junction of alpha motor neuron. This retrograde transport to the CNS is similar to that used and caused by the viruses like herpes virus and the rabies. These also move retrograde. It blocks release of the neurotransmitter which are inhibitory mediators like GABA and glycine, and that is at the spinal synapses. So when inhibitory mediators are blocked, there will be excitatory synaptic activity unregulated, unchecked, so spastic paralysis will occur. Here one can see the pathogenesis, that it is the excitatory neuron and it is going to release excitatory neurotransmitter which just excite the muscles, and these are the muscles. Bicep brachii muscle is relaxed and the tricep brachii muscle is contracted. So that is just excitatory muscle, that is by the excitatory neurotransmitter that is going to cause the tricep brachii muscle contraction. Now, inhibitory neuron, here the toxin is going to act, that is inhibitory neurotransmitter blocks the nerve impulses, so the no nerve impulse is going to reach here at the bicep brachii, so the result will be the excitatory neurotransmitter leading to the excitation of the muscle. Now, sign and symptoms of the tetanus. Tetanus begin with mild spasm in the jaw muscle, so that it is called lockjaw. Similar spasm cause the trismus. It is just the smiling movement. The spasm affect facial muscles, resulting in side rises sardonicus, and chest, neck, back, abdominal muscles and buttocks are affected. Back muscle spasm cause arching of the body, cause opisthotonous posture. Sometimes spasm affect muscles that help with breathing, so leading to the breathing problem and ultimately the death. So these feature of trismus and rhesus sardonicus are because of the excitatory. So here one can see the picture of the trismus, and this is rhesus sardonicus and this is opisthotonous posture because of the tetanus. Now, other tetanus symptoms are fever, lockjaw, sweating, high blood pressure, muscle spasm, and difficulty in swallowing, which I told you reason for the death. Prolonged muscular action causes sudden, powerful, and painful contraction of the muscle groups that is causing the tetany, that is because of powerful muscle contraction of the muscle group, causing the tetany. These can cause fractures and the muscle tears. Other symptoms include fever, headache, restlessness, irritability, feeding difficulties, breathing difficulties, burning sensation during urination, and urinary retention, and the loss of the stool and bowel control is there. So here one can see the different symptoms seen in tetanus of the lockjaw, that is intact sensorium, headache, difficult swallowing, sore throat, irritability, tonic spasm. Prevention is by the childhood immunization. And also patient do have spasm of the facial muscle, and that is giving you the fixed smile, elevated eyebrows, jaw stiffness, fever, restlessness, chills, exaggerated reflexes, and profuse sweating. These are all the symptoms which can seen in the tetanus. Now, different forms of the tetanus are clinically there are different forms of the tetanus. Number one, generalized tetanus, neonatal tetanus, local tetanus, cephalic tetanus, ascending tetanus, descending tetanus, traumatic tetanus, purpural tetanus, autogenic tetanus, idiopathic tetanus, and the uterine tetanus. These are the 11 types of the tetanus which have been seen in different conditions.